Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the abducens nerve. The abducens nerve or cranial nerve number 6 is a purely motor cranial nerve. It innervates only one muscle, that is the lateral rectus muscle. And the lateral rectus muscle moves the eyeball laterally, so it abducts or abducts the eyeball. The abducens nerve emerges between the lower border of the pons. So here, if you look at that, this is the pons, midbrain, pons, medulla oblongata. The abducens nerve emerges from the lower border of the pons here. Okay, and it emerges between the junction between lower border of the pons and the upper part of the medulla oblongata from here. Okay, it passes through the cavernous sinus and it passes just below and lateral to the internal carotid artery inside the cavernous sinus, and it enters the orbit through the superior orbital fissure and innervates one muscle, that is the lateral rectus muscle. This is the part of the lateral rectus muscle. This is another part of the lateral rectus muscle. So this part is cut. So this is the lateral rectus muscle. That muscle is innervated by the abducens nerve or abducens nerve. Okay, so if we go to the abducens nerve nucleus, nucleus is small because it innervates only one muscle, that is the lateral rectus muscle, and that lies beneath the floor of the upper part of the fourth ventricle. We know that fourth ventricle is space lined by ependyma between the cerebellum and the brainstem. Okay, so it is a small nucleus, lies beneath the floor of the upper part of the fourth ventricle, close to the midline. Upper part of the fourth ventricle is formed by the pons, okay, and it is close to the midline beneath the facial colliculus. Facial colliculus is formed by elevation of the floor of the fourth ventricle due to the passing of the motor nucleus of the facial nerve over the nucleus of the abducens nerve. Okay, that is present in the lower part of the medial eminence. Okay, so we got that. That is the facial colliculus, receives afferent corticonuclear fiber from both cerebral hemisphere. So this is the abducens nerve nucleus, okay, and it receives afferent contribution from the cerebral cortex, so corticonuclear fiber from this side, corticonuclear fiber from other side, both side. Okay, both cerebral hemisphere is connected, and it receives tectobulbar tract from the superior colliculus. So we have the tectobulbar fiber from superior colliculus that connects the nucleus to that of the visual cortex. The abducens nerve nucleus also receives the fibers from medial longitudinal fasciculus. What is medial longitudinal fasciculus? There is a bundle of nerve fibers that connects the third cranial nerve, the fourth cranial nerve, sixth cranial nerve, and the eighth cranial nerve. Okay, so it is getting connection from cerebral cortex from both sides, connection from the tectobulbar fiber, the superior colliculus, connection from the medial longitudinal fasciculus. So it works along with other cranial nerve number 3, 4, 6, and 8 cranial nerve. Okay, so abducens nerve lesion, the most common isolated extraocular muscle palsy, convergent strabismus. Okay, so idea is that eyeball cannot move laterally. Eyeball is moving medially by the unopposed action of the medial rectus. Lateral rectus is not working here, so there will be convergent strabismus. There will be horizontal diplopia, specifically at the gaze at the paralytic site. Okay, there will be horizontal diplopia. So what are the causes of abducens nerve lesion? Okay, it may be idiopathic, we don't know the exact cause. Sometimes it happens without any specific cause. Vascular disease like aneurysm of the internal carotid artery, or maybe some type of vasculitis like temporal arteritis. Diabetic complication. Diabetic complication may damage the nerve directly. Tumor, it may be any type of tumor around the cavernous sinus. Okay, maybe meningioma, maybe a metastatic tumor. Okay, trauma, because this nerve passes through the supraorbital fissure. So if any type of inflammation in the supraorbital fissure, or any type of trauma or destruction in the passage of the abducens nerve, may lead to the abducens nerve related paralysis that may happen, or that may happen due to involvement by a tumor trauma. And also in multiple sclerosis, multiple sclerosis may damage the optic nerve, plus it may damage the abducens nerve. Okay, so but most common cause is the idiopathic. Okay, and that's all about the abducens nerve or sixth cranial nerve that innervates only one muscle, that is the lateral rectus muscle. And these are my references, and that's all. So please share the information with your friends. If you have any question, please feel free to ask me, and please support my channel. Please subscribe me, and have a nice day. Bye now.